151. Which hormone is primarily responsible for regulating sodium levels in the blood? Answer: aldosterone. Explanation: aldosterone, secreted by the adrenal gland, regulates sodium levels by promoting reabsorption, critical for maintaining fluid balance in endocrine disorders. 152. What is the primary nursing action for a patient with a blood glucose level of 60 milligrams per deciliter who is alert? Answer: provide oral carbohydrates. Explanation: providing oral carbohydrates corrects mild hypoglycemia in an alert patient, a critical intervention to prevent neurological harm and ensure safety. 153. Which gland is responsible for insulin-like growth factor 1 production? Answer: liver. Explanation: the liver produces insulin-like growth factor 1 in response to growth hormone, critical for assessing growth disorders and endocrine management. 154. What is the primary symptom of a patient with diabetic nephropathy? Answer: proteinuria. Explanation: proteinuria, due to kidney damage in diabetic nephropathy, guides renal assessments and glucose control to slow endocrine disease progression and ensure safety. 155. What is the priority nursing action for a patient with suspected hypopituitarism? Answer: assess hormone levels. Explanation: assessing hormone levels identifies deficiencies in hypopituitarism, a critical step to guide replacement therapy and ensure endocrine patient stability. 156. What is the primary patient education topic for a patient with type 2 diabetes on metformin? Answer: monitor for gastrointestinal side effects. Explanation: teaching monitoring for gastrointestinal side effects ensures metformin tolerance, a critical step to maintain glucose control and endocrine health. 157. Which laboratory test confirms hyperthyroidism? Answer: elevated free thyroxine. Explanation: elevated free thyroxine with low thyroid stimulating hormone confirms hyperthyroidism, guiding treatment to normalize endocrine function and patient health. 158. What is the primary nursing intervention for a patient with Addison's disease experiencing weakness? Answer: administer hydrocortisone as prescribed. Explanation: administering hydrocortisone corrects cortisol deficiency in Addison's disease, a critical intervention to alleviate weakness and ensure patient stability. 159. Which hormone is oversecreted in a patient with prolactinoma? Answer: prolactin. Explanation: excess prolactin causes symptoms like galactorrhea in prolactinoma, guiding endocrine assessments and interventions to manage pituitary function. 160. What is the primary symptom of hypocalcemia in a patient with hypoparathyroidism? Answer: tetany. Explanation: tetany, due to low calcium levels, signals hypoparathyroidism, guiding calcium supplementation to prevent neurological complications and ensure safety. 161. Which gland is responsible for glucagon secretion? Answer: pancreas. Explanation: the pancreas secretes glucagon to raise blood glucose, critical for assessing metabolic control in endocrine disorders like hypoglycemia. 162. What is the primary nursing action for a patient with a blood glucose level of 400 milligrams per deciliter? Answer: administer insulin as prescribed. Explanation: administering insulin lowers severe hyperglycemia, a critical intervention to prevent complications like ketoacidosis in endocrine care. 163. Which hormone is deficient in a patient with Hashimoto's thyroiditis? Answer: thyroid hormone. Explanation: thyroid hormone deficiency in Hashimoto's thyroiditis causes hypothyroidism, guiding levothyroxine therapy to restore endocrine function and patient energy. 164. What is the primary patient education focus for a patient with hyperthyroidism? Answer: avoid iodine-rich foods. Explanation: teaching avoidance of iodine-rich foods prevents exacerbation of hyperthyroidism, a critical step to ensure endocrine stability and patient comfort. 165. Which laboratory test monitors adrenal function in Cushing syndrome? Answer: 24-hour urinary cortisol. Explanation: a 24-hour urinary cortisol test measures cortisol excess in Cushing syndrome, guiding treatment to manage endocrine complications and patient health. 166. What is the primary nursing intervention for a patient with suspected hyperosmolar hyperglycemic state? Answer: administer intravenous fluids. Explanation: intravenous fluids correct dehydration in hyperosmolar hyperglycemic state, a critical intervention to stabilize endocrine function and prevent organ failure. 167. Which hormone is oversecreted in a patient with pheochromocytoma? Answer: catecholamines. Explanation: excess catecholamines cause hypertension in pheochromocytoma, guiding endocrine assessments and interventions to manage cardiovascular risks. 168. What is the primary symptom of a patient with diabetic retinopathy? Answer: vision loss. Explanation: vision loss, due to retinal damage in diabetic retinopathy, guides ophthalmologic referrals and glucose control to prevent further endocrine complications. 169. What is the primary nursing action for a patient with a blood glucose level of 30 mg per deciliter who is unresponsive? Answer: administer glucagon. Explanation: administering glucagon raises blood glucose in unresponsive hypoglycemic patients, a critical intervention to restore consciousness and ensure patient safety. 170. Which gland is responsible for parathyroid hormone secretion? Answer: parathyroid gland. Explanation: the parathyroid gland secretes parathyroid hormone to regulate calcium, critical for assessing bone and neurological health in endocrine disorders. 171. What is the primary patient education topic for a patient with type 1 diabetes? Answer: recognize hypoglycemia symptoms. Explanation: teaching recognition of hypoglycemia symptoms prevents severe episodes, a critical step to ensure glucose control and endocrine patient safety. 172. Which hormone is deficient in a patient with diabetes insipidus? Answer: antidiuretic hormone. Explanation: antidiuretic hormone deficiency causes excessive urination in diabetes insipidus, guiding desmopressin therapy to restore fluid balance and ensure safety. 173. What is the primary nursing intervention for a patient with suspected thyroid storm? Answer: administer beta blockers. Explanation: beta blockers control heart rate and symptoms in thyroid storm, a critical intervention to prevent cardiovascular collapse and ensure patient safety. 174. Which laboratory test confirms diabetic ketoacidosis? Answer: elevated blood ketones. Explanation: elevated blood ketones confirm diabetic ketoacidosis, guiding insulin and fluid therapy to reverse acidosis and ensure endocrine patient stability. 175. What is the primary symptom of hyperkalemia in a patient with Addison's disease? Answer: muscle weakness. Explanation: muscle weakness, due to elevated potassium, signals hyperkalemia, guiding electrolyte management to prevent cardiac complications and ensure safety. 176. What is the primary nursing action for a patient with a blood glucose level of 500 mg per deciliter? Answer: notify the healthcare provider. Explanation: notifying the healthcare provider ensures rapid intervention for severe hyperglycemia, a critical step to prevent hyperosmolar state and ensure patient safety. 177. Which hormone is oversecreted in a patient with acromegaly? Answer: growth hormone. Explanation: excess growth hormone causes enlarged features in acromegaly, guiding pituitary assessments and interventions to manage endocrine complications. 178. What is the primary patient education focus for a patient with Cushing's syndrome? Answer: monitor blood pressure. Explanation: teaching blood pressure monitoring reduces cardiovascular risks in Cushing's syndrome, a critical step to ensure endocrine health and patient safety. 179. Which gland regulates stress response through epinephrine secretion? Answer: adrenal gland. Explanation: the adrenal gland secretes epinephrine for stress response, critical for assessing cardiovascular stability in endocrine disorders like pheochromocytoma. 180. What is the primary nursing intervention for a patient with suspected myxedema coma? Answer: administer intravenous levothyroxine. Explanation: intravenous levothyroxine reverses severe hypothyroidism in myxedema coma, a critical intervention to restore metabolic function and ensure patient safety. 181. Which hormone is deficient in a patient with hypoparathyroidism? Answer: parathyroid hormone. Explanation: parathyroid hormone deficiency causes hypocalcemia, guiding calcium supplementation to prevent neurological complications and ensure patient safety. 182. What is the primary symptom of a patient with diabetic foot ulcer? Answer: non-healing wound. Explanation: a non-healing wound signals diabetic foot ulcer, guiding wound care and glucose control to prevent infection and ensure endocrine patient safety. 183. What is the primary nursing action for a patient with a blood glucose level of 200 milligrams per deciliter post-meal? Answer: document and monitor. Explanation: documenting and monitoring post-meal glucose ensures accurate tracking, a critical step to adjust therapy and maintain endocrine patient stability. 184. Which laboratory test monitors pituitary function in acromegaly treatment? Answer: insulin-like growth factor 1. Explanation: insulin-like growth factor 1 levels guide acromegaly treatment, ensuring growth hormone control and preventing endocrine complications in patient care. 185. What is the primary patient education topic for a patient with hyperthyroidism? Answer: report palpitations. Explanation: teaching patients to report palpitations ensures early intervention for hyperthyroidism complications, a critical step to maintain endocrine stability. 186. Which hormone is oversecreted in a patient with Cushing's disease? Answer: cortisol. Explanation: excess cortisol in Cushing's disease causes weight gain, guiding endocrine assessments and interventions to manage metabolic complications and patient health. 187. What is the primary nursing intervention for a patient with suspected adrenal crisis? Answer: administer intravenous hydrocortisone. Explanation: intravenous hydrocortisone replaces cortisol in adrenal crisis, a critical intervention to prevent shock and ensure patient safety in endocrine emergencies. 188. Which gland is responsible for thyroid hormone secretion? Answer: thyroid gland. Explanation: the thyroid gland secretes thyroid hormone to regulate metabolism, critical for assessing energy levels in endocrine disorder management. 189. What is the primary symptom of hypercalcemia in a patient with hyperparathyroidism? Answer: confusion. Explanation: confusion, due to elevated calcium levels, signals hypercalcemia, guiding neurological assessments and interventions to ensure patient safety. 190. What is the primary nursing action for a patient with a blood glucose level of 90 milligrams per deciliter before exercise? Answer: provide a carbohydrate snack. Explanation: providing a carbohydrate snack prevents exercise-induced hypoglycemia, a critical intervention to ensure endocrine stability and patient safety during activity. 191. Which hormone is deficient in a patient with panhypopituitarism? Answer: all pituitary hormones. Explanation: panhypopituitarism involves deficiency of all pituitary hormones, guiding comprehensive hormone replacement to restore endocrine function and patient health. 192. What is the primary patient education focus for a patient with diabetes insipidus? Answer: monitor urine output. Explanation: teaching urine output monitoring prevents dehydration in diabetes insipidus, a critical step to ensure fluid balance and endocrine patient safety. 193. Which laboratory test confirms prolactinoma? Answer: elevated prolactin levels. Explanation: elevated prolactin levels confirm prolactinoma, guiding treatment to manage pituitary function and prevent endocrine complications in patient care. 194. What is the primary nursing intervention for a patient with suspected diabetic neuropathy? Answer: teach foot care. Explanation: teaching foot care prevents injury in diabetic neuropathy, a critical intervention to reduce infection risk and ensure endocrine patient safety. 195. Which gland regulates blood glucose through insulin secretion? Answer: pancreas. Explanation: the pancreas secretes insulin to lower blood glucose, critical for assessing metabolic control in endocrine disorders like diabetes mellitus. 196. What is the primary symptom of a patient with thyroid cancer? Answer: neck mass. Explanation: a neck mass signals thyroid cancer, guiding endocrine assessments and surgical referrals to ensure timely treatment and patient safety. 197. What is the primary nursing action for a patient with a blood glucose level of 300 milligrams per deciliter? Answer: administer insulin as prescribed. Explanation: administering insulin lowers elevated blood glucose, a critical intervention to prevent hyperglycemia complications in endocrine care. 198. Which hormone is deficient in a patient with Graves' disease? Answer: none. Thyroid hormone is oversecreted. Explanation: Graves' disease involves thyroid hormone oversecretion, guiding antithyroid therapy to normalize metabolism and ensure endocrine patient stability. 199. What is the primary patient education topic for a patient with adrenal insufficiency? Answer: stress management. Explanation: teaching stress management prevents adrenal crisis and adrenal insufficiency, a critical step to ensure endocrine stability and patient safety. 200. What is the primary nursing intervention for a patient with suspected hypernatremia? Answer: administer hypotonic fluids. Explanation: administering hypotonic fluids corrects hypernatremia, a critical intervention to restore fluid balance and prevent neurological complications in endocrine care.